So I'm Dr. Galyna, the world exfoliation. We need to exfoliate our skin to break down the dry, dead cells, gives you that dull, boring appearance. Underneath that outer layer of your skin lies beautiful, new, shiny, bright skin cells that really want to come to the surface. So we need to help them a little bit. How do we usually exfoliate? First of all, there is mechanical exfoliation. It used to be that really awful plastic little beads that, not good for the environment. So we get rid of them. Now we are talking about some organic particles such as apricot, walnuts, the shells, but again, they might be rough on the skin, so there is a whole new world of chemical exfoliation. And again, don't be scared of the word chemical, it still comes from organic source, mostly from fruits. AHA stands for alpha hydroxy acid and BHA stands for beta hydroxy acid. And those two are the most common ingredients when it comes to chemical exfoliation. Probably you've all heard of glycolic acid, but we also have lactic, malic, tartaric, citric. Why is it important to distinguish them? First of all, their molecule is different. Glycolic is the smallest molecule, and then it gets bigger and bigger. What does it mean for your skin? This penetrates easy into the skin. So this one is the strongest. The smaller the molecule, the more irritation it's gonna get because it's going to penetrate into the skin and break down the bonds between the cells of the skin faster, stronger. So you will have more reaction, will be more effective, but you will also have more red skin. When it comes to beta hydroxy, salicylic acid is what we all know, and also that is probably the most used ingredient. Important thing to understand, because some patients get confused which is the best acid for my skin. Imagine AHA, alpha acid. They just glide on the surface, whereas beta AHA, they go dive into the pores. Why is it happening? Because AHA is water soluble, BHA is oil soluble. So they go into the depths of the pore and almost wash off all the grease that sits inside the skin. That is important to understand. Water, surface, oil, deep into the pores. So if you have oily skin, where's you gonna go? Beta. So if you have dry skin, you will go AHA, alpha hydroxy. Dry skin, wrinkles, sun damage, uneven tone. If you want help with acne or pimples or breakout, if you want to reduce the inflammation in your skin, then you will go beta hydroxy acid. So the important thing to look out for when you are looking for an alpha hydroxy or beta hydroxy acid is percentage. Salicylic acid comes in 1 or about 2%. Glycolic acid and lactic, malic, tartaric, citric, they actually come in a more variety of percentages. And this is 5, 10, 15, 25. And sometimes you will see some products that contain both A and B. Now, what you have to look out for is also the pH balance. 5% glycolic acid, but with a pH of 3 will be stronger and more irritant to the skin than a 10% glycolic acid with a pH 4. So it's not only the percentage, it's also the pH. Now the simple rule applies. The lower the pH, the more irritant or red skin will be, the more downtime you will have. Higher the percentage, again, the more irritant or red skin you will have. But I'm afraid red or irritant skin will actually mean that your peel or your acid product is working. Use your product wisely. Start low. Low percentage, short period of time, go slowly. I always recommend once a week use for a couple of weeks, then twice a week use for a couple of weeks, and only then you can graduate to 3 times a week. This is all confusing. So each beauty company will have their instructions on the box. Follow the instructions. If you can invest into your skincare, use active ingredients and try to go medical grade skincare. Basically, you need a doctor. Don't forget to use sun protection. Whatever active ingredient you are using, newer, fresher skin is coming to the surface and it needs protection. Hopefully that was useful, and if anything, you can DM me all your questions.